if I get a droopy brow from box, will it be permanent?
So we'll talk about why that is beeped in a minute. But no, it will not be permanent. So your worst case scenario with anti-wrinkle injections, and I'll explain why I say that instead of in a minute. Worst case scenario is a droopy brow or a brow or an eyelid ptosis. Now, some patients will come back and they'll go, oh, I've got droopy brows, and then maybe just got like a heavy feeling. Now, if you get a brow or an eyelid ptosis, you will know about it because you will literally not be able to open your eye because your actual eyelid muscle will be paralyzed essentially and like drooping. And there was this really interesting case a couple of years ago. It happened to a female who was overseas, and she documented the whole thing on her Instagram. And it was really eye-opening for a lot of people that can happen. Now, it is absolute worst case scenario. It's like a less than 1% chance. So it comes down to us obviously injecting a correct dose and the correct placement and not overdoing your treatment and not going into areas that are not safe to treat with the product. But also it is so important that you follow that post-care. So like we were talking about before, main thing is that no lying flat for 4 hours. Not having, not exercising, not having facials, massages, anything that could potentially move your product around, and that product could then enter a muscle where we didn't inject it and then cause a potential, and we're talking like a full like brow or lid, like not able to open your eye. Now, it is not permanent, it's temporary, it wears off. It would just be super frustrating because for some people, most people the product lasts around like 3 to 4 months. Some people it can last more like 5 to 6 months depending on their metabolism. So you could be stuck like that for quite some time. So again, it's really important that you do take those risks and the post-care really seriously. It's not something that we're seeing regularly. It is very rare, thank goodness. And I haven't had any patients with a full brow or lid ptosis. Touch. Is there any wood around me? Touch wood. Heaviness, yes, but often it's just that kind of like that feeling, and we either need to let it ease or just like back off your dose a little bit. So extremely rare for that to happen. It is temporary. It wears off. And there are, I was talking about that person who shared it online. There are some eye drops and things that you can get to help kind of like stimulate the muscles around the eye, and that did kind of alleviate that for her a little bit.
Yeah.
But hers did last a good, sort of 12 weeks or so. I want to explain why we had the beeps. So you might think we're swearing. Well, the TGA would think we're swearing. So the TGA is the Therapeutic Goods Administration in Australia. So they regulate medications and everyone calls it, but that is actually the brand name of the medication. So on social media, on online, everywhere, as injectors and cosmetic clinics, legally we're not able to say those brand names because that's considered, advertising and persuading and things like that. And a lot of people, they'll just call it, but they don't realize that there's actually now recently 4 different brand names for that medication, which is botulinum toxin type A, which is the muscle relaxant. And so that's why you'll hear us, on social media or writing and things like that, we'll refer to it as anti-wrinkle injections. And the same thing goes for dermal fillers. And everyone sort of knows it as a dermal filler. Like no one comes in saying, and says like the brand name of it. Everyone just says filler. But actually there are many different brands of dermal filler in Australia as well.
Yes.
So that's why we're never talking about those brands online.